So you're disabled. Everyone keeps shouting at you online that reform will be the next government. How does that look for you? Well, first and the most obvious, your income is on the line. Reform UK wants a total overhaul of disability benefits. They're talking about reassessing millions of people only face-to-face, tightening eligibility for PIP and sickness benefits, and making it harder to stay on long-term support. They also support sanctions and tougher conditionality. They've repeatedly said that too many people are economically inactive, and Farage has backed policies to move more disabled people into work, whether or not they're able. If you rely on PIP, ESA or universal credit, these proposals could hit you directly. Now let's talk about your rights. Reform UK has openly said that they want to scrap the Equality Act and replace it with something else. But the Equality Act is the law that legally forces employers to give you reasonable adjustments, like flexible hours, adapted equipment, hybrid working, or extra time for tasks. If that law goes, those protections could vanish. Adjustments become optional. You'd be relying on the goodwill of your boss instead of your legal rights. And remember, Reform MPs, including Nigel Farage, voted against Labour's Employment Rights Bill, the bill that would have guaranteed things disabled people rely on, like day one sick pay, predictable hours instead of 0 hours contracts, stronger protections from unfair dismissal, and more flexible working. If you have a fluctuating or chronic condition, losing those protections could make you far more vulnerable at work. Then there's the NHS. Farage has repeatedly suggested that the UK should move towards an insurance-based model, and in his January 2025 LBC interview, he said he was open to anything, including replacing the NHS with a system where private insurance companies compete. He's praised continental insurance-funded models and said the current NHS isn't sustainable. For disabled people who often need regular appointments, medication, mobility aids, therapies or specialist care, that could mean higher costs, more means testing and reduced access if insurance companies decide that your condition is too expensive. There's also a rights issue that doesn't get talked about enough. Reform wants to pull the UK out of the European Convention on Human Rights and scrap the Human Rights Act, and also replace, as we said before, the Equality Act. Those things together currently protect you from discrimination by public bodies, employers, landlords, and the government. Without them, it becomes harder to challenge unequal treatment, discrimination, inaccessible services, or unfair decisions. There's also a risk to social care and carers. They also plan deep cuts in public spending. That could mean less money for local authority social care, which could put more pressure on unpaid carers, who may have to do more if formal care is cut back. So remember, when bots say reform, or people online say reform will sort things out, remember this isn't just about tightening benefits. It's about weakening your rights at work, your legal protection from discrimination, and potentially pushing the NHS towards an insurance model that could charge you more simply for being disabled. For disabled people, these policies aren't abstract. They're life-changing. They affect your income, your healthcare, your working rights, and your dignity. I've put all of the sources at the bottom of the screen. Stay informed and stay loud.